welcome to our second episode of On Your Way Out. We have a very special guest with us today. We've got Dr. Barry Saltz.
Thank you for having me. Thank you, the audience. Thank you. Thank you.
So Dr. Saltz, for those of you who are at NYU or went to NYU, Dr. Saltz actually graduated from NYU, got his DBS there.
1984.
1984. Well, you didn't have to tell me that part, but
Okay.
if you want them to know, doesn't look it, but 1984. And then, ever since then, he's been in private practice for over 30 years. We're lucky to have him at UNE. He is one of the clinical faculty here, and I've done a lot of work with him. So we're very lucky to have him. So give it up for Dr. Saltz.
Thank you.
And you probably had no idea what our topic is for today, but I'll give you a little hint.
I don't know. What is it? I don't know.
So we are going to be talking about ethics and professionalism. Pretty hot topic, I will say.
Always.
So we'll just jump right in. I have a couple questions for Dr. Saltz, and I'll just get started with the first one. So first one's pretty controversial. Are you ready for this?
I'm ready. Let me sit down. Okay, I'm ready.
Yeah, you're going to want to sit down for this one.
Okay.
So let's talk about ethics and professionalism then. Okay. So I'm sure you guys have probably all heard about the dentist who was doing extractions on a hoverboard.
Yeah, not too smart.
Yeah,
not too smart.
That went
not
viral.
Very ethical, and certainly not professional.
Definitely.
So that came on. You saw that? That made national news. So that was not a good thing. What ended up happening was that not only was he busted, right? One of his staff members actually videotaped it and uploaded it. But the problem on top of that he was also convicted on 46 cases of fraud, Medicaid fraud.
Yikes.
So that was really the coup de grace of the entire case. But in terms of professionalism, you certainly can't do that with a hoverboard.
I saw the video
certainly
and I was
can't do that.
mortified.
It's unethical, it's not right, you can injure the patient. This was not good. In the least, it's a state board complaint and probably get your license pulled. So not a smart thing to do, and if the patient's injured, you're looking at even more than that. In this particular case, this went bad from the beginning, and this had been ongoing. This was 2017. I think he's now fitting into a nice orange jumper. I don't know, but something along this style. Maybe it's leopard jumpsuit. I don't know what he's wearing. But anyway, either way, you want to make sure that you're ethical and you're professional in practice. Always do the right thing. If you think it's not right, it isn't right, and don't do it.
Yeah, that's good advice. Because obviously that's an extreme example, right. But at the same time, for newer graduates, it's kind of hard. There's kind of a fine line sometimes that we might want to cross. Do you have any advice for us who are, new grads and we're put in a weird situation, like an ethical or professional situation?
You know from mom and dad what's right and what's wrong.
True.
And again, like I said, if we've had some classes here at UNE, and I'm sure other schools across the country have the same. If you know something isn't professional, it's not right, just don't do it. And remember, patients judge you not only when you're in your dental office, but if they see you at the shopping center, you go here or there, you're at the market, they look at you. You're a professional in the area, and you're not a kid anymore. You have to act it. And a lot of people look up to you as a doctor in the community. So just remember that. It's about professionalism, leadership, and ethics all wrapped into one. So be careful.
Okay, perfect. Good.
Thank you.
Awesome. Well, let's talk about another. Awesome.
Okay.
The accent.
All right, I'm ready. Let's go.
We'll talk about another topic that a lot of us have struggled with but gotten better at thanks to none other than Dr. Saltz here at UNE. But let's talk about writing notes. There's a lot to consider.
A lot of notes there. What do you mean?
Notes here. My notes here are actually pretty concise.
Good.
Thanks to Dr. Saltz, who's slashed a couple of words. So there's a lot to consider when we're talking about writing notes. Sometimes providers can be a little bit skimpy on the details, but there are certain things that we want to make sure to include. Right. Where would you say, what are those things that we should always include and, to just cover ourselves?
So I think the important thing when you're taking notes, you want to be succinct. You don't want to be overly verbose. This isn't an English paper that you wrote in 7th grade, or maybe the one you wrote to get into college, but you want to be succinct yet germane. So you want to put all the important points in. And the thing that will really get you in trouble is what I tell our students are really the soft issues, right?
Okay.
The issues that perhaps you recommend crown lengthening, right? And the patient says, I'm not interested. You go ahead and you do the crown, and a few years later they come back, there's an issue. You better have that in your notes.
That you suggested.
So it's not necessarily that you use the number 2 round burr, or maybe a number, a 330 on your high-speed handpiece. You want to put down the name of the materials, specific names, but it's important to be succinct yet germane in all your notes.
Filtex
right?
Supreme.
And
Filtex Supreme.
and Filtex Supreme. I know what you're using at the NYU today, but anyway, but you want to write down the name of the materials, and again, not overly verbose, but you want to be able to put down what you're doing, the procedure, and those soft notes are very important. And I like to use a lot of quotations. So if a patient says, for whatever reason, they can't do it for whatever, whether it's finances or this or that, you want to put that in quotes, because years later it can always come up and it can help you. The other important thing when you're writing notes, Yalda, and to you out there, is that you always have to remember that patients have the right to review the notes.
Oh, okay.
They can always see the notes. Even though they're yours, they can have access to it.
They can request it.
They can request it. And if there's a state board complaint or a malpractice suit, they're certainly going to be able to look at those notes.
Okay.
So if that happens, you never want to write anything in the notes they will look at and they will be upset at.
Okay.
So there are certain ways of wording things that you can write in the notes that will accomplish the same thing without degrading your patient or saying something in such a way that would upset them.
Okay.
Okay?
That's
So keep that in mind.
Okay. That's a really good point. I actually did not know that they were able to request that.
Now you know. That's why we're doing
Gotta go
this.
back to some of my notes.
No, come on. That's why we're here.
Good. Well, thank you for that.
You're welcome.
Building off that.
Off.
You know, there's a lot of talk about malpractice and lawsuits and state board complaints. How can we protect ourselves from things like that? We don't really get a lot of information about any of that while we're in dental school. We kind of get the bare minimum.
You should have taken the course that we ran through ASTA. Were you there?
Right. No, I wasn't. Yeah, I wasn't. I wasn't there.
All right. Maybe you guys can come next time.
Have it again.
All right. So let me tell you.
Yeah.
So I want to do. There are two pathways, right? Either pathways of trouble for us as dentists. One is through the state board, right? We want to avoid state board triggers and also malpractice claims. So I'm going to go through the top six that we covered.
Top six.
The heavy six. All right.
Heavy six.
So let's go. Number one, have a drum roll. Big on the list, money.
Money.
Everything boils down to money. Huge.
Huge.
So everything boils down to money and funds. So whether it's money owed or money paid or an outstanding balance, you have to really think twice whether you want to send the patient to collection or not. Because that in itself can trigger a suit or again, a state board complaint. Right? Both different avenues. One, if the state board complaint is egregious enough or there's some damage to the patient, they can then file a malpractice claim. But either way, none are fun to wake up to and do. So you have to be judicious about money. You have to be clear in communication, and you really have to let people know what's going on. When it comes to money, make sure that everything is caught up. You don't want to make sure, again, if the patients are getting behind in their bill, it's that much tougher to collect at the end. And if they don't pay you, again, you have to really think twice, depending, if you get to the point they haven't paid, and with collections, is everything okay or not? And again, just be careful.
Is it worth it?
Is it worth it? I mean, most of the time, no problem.
Yeah.
You do what you got to do. But there are some cases, gee, did I do this? What's the patient like? Is there any animosity? Are there any ill feelings? Maybe it's better to write it off.
Okay. All right, good point.
So keep that in mind. And it's always better, sometimes if patients want their money back, penny tight and pound foolish, the cost of doing business, just write them a check. Okay, so keep that in mind too. I'm not talking for all your cases, but the ones that keep you up at night, it's just not worth it. Sound advice. Remember that, y'all.
I will.
All right. Second thing is poor communication, right? So a breakdown, those are the top two things. So if there's a breakdown in communication, that's tied with money, right? If there's problems and there's bad communication with the staff, or it could be with you, there's a breakdown, that's number 2 on the list. Third thing is really unmet expectations. So whether it's cost, right? Yeah, I didn't agree to that. That's not what you told me. Time, it's taking too long. Appearance, comfort, courtesy, anything like that. Again, with you, your staff, they make an appointment, patient shows up, it's not in the appointment book. The patient's going to be upset. All of those things can trigger problems. A patient has pain. All of a sudden now you've seen them for all of their crown and bridge work, but guess what? You're not making time for them.
That's true.
That's a problem.
That goes back to actually one of the things that Dr. Saltz told me I will never forget. This was probably like second year. Under promise and over deliver.
Yeah.
I remembered.
Right.
See?
Right.
Stuck with me.
Stuck. Good. I like that. I like that. So add that. Write that down, everybody, in TV land. All right. The next one I want to talk about is revenge or spite.
Ooh,
right.
Okay.
So let's say you build somebody and something went a little bit awry. They don't want to pay. They end up paying you, or maybe something happened. You weren't able to get them in for that emergency appointment. Revenge or spite is a way that they can come back at you, and again, that more could be a state board complaint. But if they feel slighted in some way, maybe the staff said something wrong to them.
Okay.
Maybe you weren't listening, carefully enough. But something happened that made them feel slighted. They can come back and whatever.
Scary stuff.
Anybody can pick up the phone and file a state board complaint. It doesn't have to be negligence, and that just triggers a cascade of things that, as the practitioner, that you will then have to do, and that's not fun.
That's
right
scary.
or wrong, the case can be dismissed, but just going through that gauntlet, you don't want to do.
Okay.
So again, you want to be nice, and you want to avoid the revenge or spite. Not good. The other thing is treatment errors. Listen, we're human. Things are going to happen. If it happens, you want to do what you ideally want to do. If you can, get the patient to a specialist, right? Refer to a specialist. Mitigate the problem. Certainly don't make it any worse. You're doing extraction, the tooth fractures. As a GP, it happens.
Mm-hmm.
Call up, facilitate the movement, get the patient to a specialist. The biggest thing is, don't bite off more than you can chew. Use your specialist, find the best specialist in the community, and work with them. Okay, that's very, very important. And again, if there is an error, you want to be honest and tell the patient exactly what happened. Don't sugarcoat it, don't undercoat it, tell them what happened, and tell them how you're going to make it better, and make sure you rectify the problem. And finally, which ties into treatment error or accidents, because they will happen, and again, be honest and tell your patients. And I think those are the big ones. So if you can manage all of that, you're going to be okay. Good luck.
Just how many was that? 7, 6, 7 things?
That was 6. That was 6.
I think we can remember that. Maybe I'll have to write that in the caption.
All right. Well, watch this podcast. All right. How you can go. All right.
Are there any other tidbits? Anything else that you can give
I'm
us?
glad you asked me about the very important.
Some clinical pearls.
Tidbits. So clinical pearls. So again, good communication is key.
Okay.
Right? Unfortunately, as dentists, and I think men worse than women. I think women are good listeners. Let's be honest.
We are.
I know. Men
Can't disagree there.
but not always good listeners. Ask my wife. Cut that out. I don't want to see that. But anyway, so you want to make sure that you listen to your patients, right? Don't jump in. I know we're all excited. We want to make the diagnosis. We want to tell the patient what's going on, but you don't want to do that, Yalda. You want to make sure that you listen to what your patient has to say.
Okay.
Listen to the whole thing. The patient's coming in with a problem. You want to listen and then respond. So don't jump in. And you want to show in your notes, in everything that you do, you want to show empathy.
Okay.
Right? So you want to show concern. I mean, these are common sense things, but sometimes we don't think about it. But this is all very important. You want to choose your words carefully when you talk to patients. Right? You want to be kind, you want to be nice, you want to be empathetic. And the other thing is that there are times when you're doing work that you have to use informed consent.
Okay.
Right? You have to use informed consent. So there's implied consent and there's express consent. Implied consent is the consent when you sign at the end of a medical history form, and you give the dentist or the practitioner a general bill that they can. That it's okay to review things at the 30,000-foot level.
Okay.
And then there's expressed consent, right? So if you're going to pick up a handpiece and adjust a tooth, you want to ask the patient, is it okay? I'd like to adjust. You're complaining of pain on X tooth. May I adjust it? You pick up a handpiece or you do some type of work, you want to make sure that you have that written down and the patient responds.
So you should put it in your notes.
Express consent, right, that you asked the patient and the patient responded. If you're doing a big prosthetic case, if you're doing periodontal surgery, certainly if you're taking a tooth out, if you're doing a root canal procedure, endodontics, you want to have written consent. That also comes under the express consent, but you want to have it signed, not orally written in the chart, but you want to have that oral, written, and also signed on a piece of paper.
Cover everything. Okay.
You want to cover your bases, so that's important. You also want to make sure you have a good treatment plan, a good diagnosis, everything that you learned in dental school. That means diagnostic models. That means good photographs.
Yep.
We learned 5 at the school.
Stuff's not going away.
It's great to take 20. Great to take more. Better take more than less.
Mm-hmm.
All right. So you want to have all that diagnostic information before you treat your patient.
Okay.
All right. A good full set of X-rays. Everything that you learned. Don't cut
corners.
How'd you know? How'd you know that's what I was going to say?
Read your mind.
You need infection control, right? There's nothing worse today with HIPAA and OSHA and everything else, not only to violate like this dentist did with the hoverboard, and somebody filmed them, that was a HIPAA violation in the operatory.
And I read the patient actually had no idea. She was like sedated.
Terrible.
She had no idea.
Right? So building off of some of that is the infection control.
Mm-hmm.
So you better have in your office a good infection control protocol, because there's nothing worse than using instruments, and it can happen, that aren't sterile in someone's mouth. Right? They may be clean, but they didn't go through the sterilizer. There's an issue. I can promise you will hear from HIPAA, and they will, or OSHA rather, and they will shut your office down.
Okay.
Right? And it goes in the paper. It's not a cool thing.
Not a good look.
And a lot of fines to be paid. All right. And the other thing we talked about was good records.
Mm-hmm.
So good record keeping, right? Very important. And I think we covered it. I think we
covered it.
That
was a lot of info. I'm gonna have to write a long caption.
You write it down. Come on.
You guys will remember all
that,
that, right?
Be succinct, right?
Be succinct.
Be succinct, but you get it all.
Get it all.
Get it all.
All the important stuff.
And use big words. Doctor words. Don't use what, the high school
right.
stuff.
You always say
use
that.
Medical terminology. Assume that your medical colleagues are going to read it.
Yeah.
Right? So instead of broken, you may want to write fractured. Instead of gums, make sure you're gingiva, right? Simple things we don't think about.
Instead of numb,
but now that you're
anesthetized.
wait a second, right?
You may have
so
said that too before.
those are the kind of things that you want to keep in mind, all right?
Okay.
This was great.
This
Thank
was
you
great.
For
Well,
having
before
me.
you go, do you have any last words for, the class of 2020, the graduating classes, anything you want to say to us?
The incoming class.
Or the incoming classes, they'll probably watch this too.
So the only thing I can say is this is the best profession. It's great. I've had a wonderful life. I feel that at the end of my career, finishing up teaching.
You still got a long career. I don't know what you're talking about.
Well, this is the best. And I just want to say you've made the right decision to go into dentistry. And I want you all to get involved in organized dentistry. And there are so many different organizations and things that you can do, because dentistry is great. And get out and meet your colleagues and peers. It's just, I can't speak more highly enough about it. So enjoy.
Great.
It's a great ride. So have fun.
Awesome. Well, thank you so much,
you.
Dr. Saltz.
Really
appreciate it.